Good day and welcome to the National Resource Center for Healthy Marriage and Families Supporting Parents of Children with Special Needs webinar. Today's conference is being recorded. At this time, I would like to turn the conference over to Ms. Jackie Rhodes. Please go ahead, ma'am.
Thank you and welcome everyone. Thank you for joining us today for the National Resource Center for Healthy Marriage and Families webinar Supporting Parents of Children with Special Needs. My name is Jackie Rhodes, and I'll be helping with the logistics for the webinar today, along with my colleague Brianna Carroll and Resource Center Director Robin Senazal, who will be moderating. Before we get into the content for today's webinar, I'm just going to walk through a few logistical items. The webinar today will be an hour and a half, ending at 3:30 p.m. Eastern Time. The webinar will be recorded, and the slides, transcript, and recording will be posted on our website in the coming weeks. Audio for the webinar will be broadcast through your computer. Please make sure your speakers and volume are turned on and up. If you have any technical issues, problems seeing something or hearing something, you can send us a message in the Q&A box on your screen or call us at 1-866-916-4672, and we will be sure to assist you. After the presentations today, we will have an online Q&A session. We encourage you to type in questions you think of at any time during the presentations by typing them into the Q&A pod located at the bottom right corner of your screen and clicking enter. We will collect submitted questions and then address those during the Q&A session at the end of the webinar as time permits. If your question is for a specific presenter, please reference that when submitting it. Throughout the webinar, presenters may reference materials or links relevant to their presentation. You can browse web links by clicking on any of the links in the web links pod in the top right-hand corner of your screen, and you can download materials by selecting files in the downloadable resources pod on the right-hand portion of your screen as well. We're excited about the agenda for today's webinar. The agenda includes an introduction of our speakers, followed by a welcome and overview of the Resource Center. We will then pass it over to our speakers, who will share tips for supporting parents who learn that their newborn has a developmental disability, tips for preparing youth with disabilities for adulthood, and an overview of parent centers and how they can help. And then we will end the webinar with a discussion and Q&A session. When we close, a brief feedback survey will pop up on your screen. We encourage you to complete the survey to provide us with valuable feedback for improving future webinars. Once you complete the survey, you'll be able to download a certificate of completion for attending today's webinar. And before we begin, I'm just going to briefly introduce our speakers for today's webinar. First, we will have Robin Senazal, who is the Director of the Resource Center and a Director of Family Strengthening at ICF. Robin will be sharing more with you about the Resource Center and will moderate today's session. After Robin, we will hear from Dr. Lauren Clark, who is a nurse anthropologist and the Shapiro Family Endowed Chair in Developmental Disability Studies at the UCLA School of Nursing. Lauren received her PhD in nursing at the University of Arizona. She has conducted research to assess quality of life and overall happiness and health of people with disabilities, and has also worked with parents to address questions they ask after bringing home a new baby with a developmental difference. She is also the author of a new Resource Center tip sheet, Tips for Parents Who Learn Their Newborn Has a Developmental Disability, and you can download that tip sheet directly from the downloadable resources pod on the right-hand corner of your screen. After Lauren, we will hear from Dr. Ann Kirby, who is an assistant professor of occupational therapy at the University of Utah. Her research focuses on individuals with autism spectrum disorder and their families, with an emphasis on preparing youth and families for successful transition to adulthood, as well as on suicide risk and prevention. She's worked with people on the autism spectrum for over 15 years, and she earned her PhD in occupational science from the University of North Carolina at Chapel Hill. And like Lauren, Anne has also recently authored a tip sheet for the Resource Center focused on tips for parents preparing youth with autism for adulthood. And you can also download that from the downloadable resources pod on the screen. And both of these tip sheets are also available in our resource library on the Resource Center's website. And then finally, we will hear from Joey Hanna, a Salt Lake City native who graduated from the University of Utah with degrees in behavioral science and social work. She has worked in early intervention in Head Start and early Head Start programs in Salt Lake City, as well as with the Utah State Disability Service Agency. Ms. Hanna joined the Utah Parent Center as the executive director exactly 1 year ago today. And she has an amazing family, which includes a 13-year-old son who is a young man living with autism. To learn more about our presenters, I encourage you to download the speaker information document in the downloadable resources pod on the right-hand corner of your screen, where you'll find more detailed biographies. And now, Robin, I'll turn it over to you to get us started with opening remarks.
Thanks, Jackie, and thank you all for joining us this afternoon. I think that you're going to really enjoy today's presentation. We've got some great presenters and some really important information that we're looking forward to sharing. So let's get started with a poll question. Here's my little poll question. As we get started, I would like to find out what brought most of you here. And so if you could take a look at the poll question and answer. I joined the webinar today as a parent, caregiver, guardian, provider with a specialization focused on supporting people with disabilities, provider focused on human services, policymaker or government employee, or other. And if you indicate other, if you would just over in the little Q&A chat box, if you would indicate what other means, that would be helpful to us as well. That'll give us all a sense of who's joined us today. Great. So it looks like most of our participants today are providers focused on human services, but we do have some parents and also some who are providers with specialized focus. So that's really exciting. And then some government. So a little bit of everything here today. So thank you all for joining us. The National Resource Center for Healthy Marriage and Families, our focus is on integrating healthy relationship education skills into existing service delivery systems. We also are really focused on 4 core components. Interpersonal skills such as communication and conflict resolution, because those are interpersonal skills that are really necessary in every family relationship, whether we're talking about parents, couples, parent-child, community relations, as well as workplace relationships. So we focus on those skill areas. And we also focus on critical skills like parenting and financial education. Parenting and financial issues are the top 2 stressors across socioeconomic lines. Obviously, they can be even more challenging whenever you're in a high-risk, low-resource community or you're dealing with special circumstances. And what we think is really important to know about these skills, too, is that they can be integrated individually or collectively into existing programs to reduce stress. And if you visit the Resource Center website, you'll see lots of strategies in our Blueprint for Integration tabs on how these things can be integrated, and we also provide free training and technical assistance. So if we can help you with any of that, please let us know. So as you see, here is a snapshot of what all we offer kind of on the Resource Center. And so we have a media gallery, which includes lots of video clips. We've got a series, Dating IRL video series that's out there. Our webinars are all archived. So for you listening today, or if your friends couldn't join us, you can go back and visit this webinar. As Jackie mentioned, it will be archived along with our newsletters. And if you're not on our newsletter listserv, you should definitely get on the listserv. We put out a newsletter once a month with some great tips. We definitely don't send out too much information. There's a calendar of events. If you look at the calendar and there's an event you think should be on there, please send it to us. We're always looking for new events to highlight. And our resource library actually includes over 3,000 research-based resources that focus on a variety of issues that impact families. In addition to that, we have a virtual training center. We have 7 courses in our virtual training center. All of these courses are free. And when you complete a course, you can take a quiz, and if you pass the quiz with 80% accuracy, you can get a certificate of completion, which can be good for CEUs. I mentioned the monthly newsletter. We're also on LinkedIn and Twitter, and we're about to launch a new Instagram account. So
keep an eye out for that, but I hope that you'll follow us on those. The other thing I'd like to mention on the website is one of our new features is Strengthen Your Relationship, and it includes a lot of resources that are specific for individuals and families themselves. So it's resources that individuals can access directly or that service providers can access to share with the families that they serve. So I hope you'll take advantage of that. Over the years, as we've been managing the Resource Center and doing this work around the country with agencies who are integrating relationship education, one of the areas we've noticed a need for, and we've been trying to work to fill the gap in that need, is for stakeholder-specific and culturally responsive resources. So we've created a series of toolkits, fact sheets, research to practice briefs, tip sheets like the ones you're going to learn about today, and guides that focus on these different specific needs in specific stakeholder groups. We've got toolkits, for example, that are targeting tribal families, Latino families, African American, Asian families. We've got resources for families who are Muslim, who are Orthodox Jewish, as well as LGBTQ, and a variety of other kind of specific types of resources. So I hope you'll take advantage of those. We also have some really cool resources around family violence prevention. So if those are some of the issues that you as a service provider deal with, I hope you'll check those out as well. And so here today you have the resources that we're going to hear more about, and these are specific tips for parents. Again, this is an area that we've come to realize that there was a gap in information that was available. So what we really have tried to do is to work with experts around the country to identify some of these gaps and develop resources that are easy to understand, that synthesize research, that offer concrete tips that families can take advantage of. And so I hope that you will download these resources. They are in your downloadable resource box, or visit the Resource Center website for more of those types of resources. So I have another poll question for you. What percentage of children between the ages of 3 and 17 years of age in the United States have one or more developmental disabilities? I'll give you just a second to answer that question. Right? So it's interesting that we have 44.8% believe that it's 25% or greater. The actual answer, and perhaps we should have worded this question to say diagnosed with, because there are probably many more that are out there that are undiagnosed, but the actual answer to this particular question is 17%. But realizing that those numbers are increasing and that the need for resources that address that population is critical. I hope that you will enjoy the information that you hear from our presenters today, and as you hear tips and tools, but also about other resources that you can tap into. So with that, I'm going to turn it over to Lauren Clark.
Thank you. Thanks very much. I'm happy to be here today. Let me start by saying the observation that humans are inherently storytellers is commonplace by now. We naturally tell stories about ourselves, we tell stories about our experiences and our worlds, and it's through these repeated cycles of storytelling that we come to know who we are and what kind of life we're leading. Even more than individual stories, we as humans shaped and are then shaped by larger cultural narratives. We tell stories that give shape and structure to our life experience, and one of those very powerful narratives is the story of becoming a parent. I'm sure you can recall hearing a friend tell you her birth story and what it was like to give birth and then gaze into the eyes of her newborn for the first time. These narratives tend to vary in detail, but the general trajectory is culturally scripted. We take for granted what it's like to become a parent. So today I'm going to talk about what it's like to go off script when parents tell a new story about parenting a child with a developmental disability. Down syndrome is a common example, so I'd like to start there. Trisomy 21, or Down syndrome, is the most common genetic condition among newborns, and occurs in about 1 in every 800 births. That's a total of 5,300 babies per year in the United States. Because it's relatively common, most people know that Down syndrome is associated with certain traits, like weak muscle tone in infancy, a characteristic facial appearance, and lifelong intellectual disability. Down syndrome may also co-occur with other birth defects like structural heart or digestive abnormalities or problems with speech, hearing, and vision. Although it's common, some proportion of Down syndrome births are potentially avoidable. Since 1970, parents have found prenatal genetic testing increasingly available and progressively more accurate. And about 72% of parents will opt to undergo non-invasive prenatal testing. That provides couples with information about the likelihood of trisomy 21. In cases of prenatally detected fetal anomalies, parents can then opt for a pregnancy termination. And the best analyses to date suggest that 30% of fetuses with Down syndrome were selectively terminated in recent years. So that means that two groups of parents deliver infants with Down syndrome. First, parents who were informed prenatally of the diagnosis and continued the pregnancy. And second, parents who declined prenatal testing, or for whatever reason, they had a false negative outcome, and they learned that their infant had this diagnosis neonatally. Whatever the timing of the news, parents reconsider what to expect of their child, themselves, and their future after that diagnosis. 1 in every 6 children in the U.S. has a developmental disability, as we just talked about 17%. There are other developmental differences besides Down syndrome associated with intellectual disability, and this table shows some of the different causes, from Fragile X to meningitis. Developmental disability also includes autism spectrum disorders, although that diagnosis is often after the neonatal period. Developmental disabilities affect families of all backgrounds, races, ethnicities, and nationalities. Parents of children with any developmental difference will hear the news, and it will likely be momentous. Around the time of diagnosis, parents say that they're on an emotional roller coaster, and they feel as if their plans for the future are upended. Andrew Solomon wrote a book that parenting a child who falls far from the tree in socially notable ways poses a challenge to parents' self-identity. After the diagnosis, one is not just a parent, but a parent of a child with Down syndrome, or insert some other diagnosis there. That diagnosis changes parents' view of the future for their child. It changes their narrative of parenting, and they think about their responsibility as being a parent differently. They consider the kind of family that they will have in a brand new way. If hearing the diagnosis is difficult for parents, they're certainly not alone. A new diagnosis may elicit a mixture of feelings. Parents report feeling anger, sadness, hopelessness, as well as relief, love, and joy. A parent's developmental difference is difficult news, but not necessarily bad news. Because disability is part of the fabric of the human experience, hearing the news changes our expectations, and it's an opportunity to tell a different story. Parents often ask, what does the future hold for my child? They imagine what their child will be like over time, and they wonder if she will face a life of suffering. Parents also ask themselves if her life will have meaning, and if their life as a family will have meaning. Because Down syndrome is a common developmental disability, we happen to know quite a bit about these parents' experiences. In one study, researchers found that 99% of people with Down syndrome were happy with their life. Furthermore, 97% of people with Down syndrome said they liked who they were. Parents, too, reported a fulfilling life. The vast majority of parents who researchers contacted through a Down syndrome organization expressed love for their son or daughter, pride in him or her, and a positive outlook on life. Based on this research, you may find that whenever you ask a person with a developmental disability or their parents how it's going, you may hear something quite similar. They're happy with their life. They're happy with who they are. Now more than ever, the conversation about a newborn's developmental disability diagnosis is more than a single event. It's really a conversation over a lifetime. So what can families do to prepare for success? I'd like to offer 3 main ideas. Idea number 1, appreciate that brains and bodies adapt over time. The American Academy of Child and Adolescent Psychiatry says it this way on their fact sheet. There is hope. Every child is different, and they may reach goals not felt possible when the diagnosis of intellectual disability was made. Every baby has an uncharted future, and only time will tell what he or she will do. Over time, their personality becomes more pronounced, and parents grow to love their child and build on their child's strengths. Idea number 2, listen for and then create meaningful messages of hope. Parents can look for hope and find it in memorable messages. In talking with a number of parents, many of them hear these messages, and then in talking about it, they will quote word for word what they heard years later. They remember who said those words that shifted their perspective. They remember how it changed what they were thinking, and they remember thinking in a new and different way. Let me give a few examples of what parents told us about memorable messages of hope. One parent said her husband began singing the refrain of a popular song, "Everything's going to be all right." And she said he sang it in the bathroom, he sang it all day. And she said it really became their mantra. Another parent found purpose and meaning in his situation by reminding himself, raising her is more alike than different. And by that he meant, it's a baby, we're raising a baby, and she's more like other babies than anything else. A mother said she thought of parenting a child with developmental disability as seeing a new color for the first time. These parents hadn't expected to raise a child with a developmental disability, and they may not have chosen this path, but they found meaning in their experience and in their family life. And idea number 3, promoting our child's well-being at home, at school, and in the clinic. Let me start with the first idea, promoting our child's well-being at home. Talking, reading, and cuddling in a safe and loving environment can help every child learn and grow. By limiting screen time, your child will be able to learn through creative play, observation, and imitation. The American Academy of Pediatrics suggests that parents and children engage in back-and-forth talk time every day to develop language awareness and skills, and unplugging from screens makes space for that talk. Parents also may wish to monitor their child's development at home, and they can do that using a developmental checklist of milestones. Those are widely available. The idea is to celebrate each milestone whenever it occurs. And then at school. By acting early, you can smooth your child's pathway into local educational services. Under IDEA legislation, educational programs are often free of charge. Sometimes hospitals offer transitional home visits by nurses or therapists, and a benefit of early intervention is that parents begin socializing with other parents and children. And then at the clinic. A developmental screening may be part of each clinic visit. That happens when a clinician provides a formal questionnaire to the parent to complete, and they talk about the child's development. A developmental evaluation is even more formal, and it often involves an interdisciplinary team. During an evaluation, the team will assess the child's development using certain tests and performance measures, and also parent questionnaires. The result of the evaluation can then help fine-tune services that the clinical team would like to employ to facilitate the child's development. Together, school, home, and clinical resources can maximize support for each child's progress. So let me sum up and return to my main point here. How can we create a hopeful story? Let's start with parents. We've already reviewed today that the answer for parents of children with developmental disabilities is the same as it is for most parents. They can and they do find ways to write their own story. Parents can share the diagnosis with their friends and their families, and they can start to educate them about developmental differences, the language, the diagnosis that is used around disability these days, and have a conversation with them. Parents can also learn skills and approaches from other parents. Parents of children with typically developing or atypically developing children may have insights to share, and parents find that useful. Use resources at home, at school, and in the clinic to support development, and we just talked about that. And then embrace meaningful messages that remind you of your beliefs about what being a parent is all about. Then adjust to your child's unique pace. Progress is possible and worth celebrating. And appreciate your child's personality. As clinicians, we can help by offering hope-affirming messages more deliberately to parents and at earlier points in the parenting experience. One father summarized his story of rescuing hope like this. He said, "We had to realize that our baby was just a baby, and our job as parents was to love him and to give him opportunities to grow into the best person he could be." So in a nutshell, that's telling a new and hopeful story. So what I'd like to ask you to do as our audience, if you wanted to write a memorable message for new parents based on your wisdom and experience, what would you say? And let me just note, you have to be kind of brief because it is just a postcard. So if you would write that down, give yourself a minute to think, I would appreciate it. I think there's a lot of wisdom in this group. The most rewarding experience in your lifetime. I've heard parents say that. Don't compare your child's special. Good, good. Keep it coming. Keep it coming. Welcome to the club and buckle up. It's okay not to love every second of it. It doesn't mean you love your child less. Never give up on creating a happy, calm environment for your child. This will allow them to have the best future. Excellent. Reframe your mindset. Your child is special. The most rewarding experience of your lifetime. Different isn't wrong. Different is beautiful. Your journey is your own. Do not measure it by comparing it to the journey of other families. Don't be ashamed. All children are unique in their own way. Your child isn't any different in that aspect. No matter what, hug often. Never give up on creating a happy, calm environment. This will allow your child to have the best future. Be patient with yourself. You know what? I'm tearing up. That was beautiful. That was beautiful. Those are exactly the kind of messages that the parents said meant a lot to them, and they wish they could have heard them more often from friends, family, and clinicians. So seriously, I'm like getting a little verklempt. Thank you. Thanks very much for sharing that. On that note, to move this along, there's my contact information. And let me say that we're very lucky now to hear from my good friend Ann Kirby. Ann?
Thanks, Lauren. Hi, everyone, and thanks for inviting me here. My name is Ann Kirby, and I'm an assistant professor of occupational therapy at the University of Utah in Salt Lake City. My research and experience has focused on youth with autism and helping them and their families prepare for adulthood. So that is the lens that I kind of am speaking from, but much of what I will talk about and what's in the tip sheet that we just put out that's available in resources is relevant to broader groups of youth. So thinking about who else this could all be relevant for as well. So we know that preparing for adulthood can be overwhelming for families. There's a lot of uncertainty and worry experienced by parents, and most often parents don't know what to do to help their child be safe and successful in adulthood. The good news is that there is research that shows that parents can make a difference. And some of the research has showed, for example, that when parents of youth with autism expect their child to be more independent as young adults, they're more likely to end up being more independent after high school. And the more opportunities children have to try and practice and try out adult-like activities, the more prepared they end up being for the future. So really, parent expectations become, in some way, self-fulfilling. So we encourage parents to think a little bigger about what their child might be capable of so that they create more opportunities for them to learn how to act in adult-like roles, and then they end up being more prepared. So today I'll talk about 4 tips to help parents do that. The first tip is be open-minded about the child's abilities. So oftentimes parents can get overwhelmed by the child's challenges and previous failures, and are likely to expect that their child is going to continue to struggle in the future as well. And while that may be the case, having an open mind about their possibilities can allow them to have the chance to build new skills. If a child never has a chance to try to do something new or build a skill that might be useful in adulthood, then they don't end up having the skills or experience when they end up needing them. So really kind of thinking broadly about what might be possible for the child can be important. The second tip is to start early and build opportunities for adult life skills into daily routines. So the best way to start preparing for adult life is to start when the child's young and introduce opportunities into their everyday lives to do new things and to think about adulthood. So in a big picture way, parents can allow and encourage their child to try new things, to make choices and decisions, to solve problems when they arise in their everyday lives, and to start doing daily activities independently. When thinking about what activities they can start working on, it can be helpful for parents to look at their own lives and think about all the things that they do within a given day or a week. Sort of what are the activities that adults do? Often our minds go straight to, we have jobs, but there's lots of things we do in our everyday lives that that youth who ultimately may want to live on their own will really need to learn about. So thinking about what things in their everyday lives their child could start helping with and learning from. Are there ways to take on new responsibilities at home, like laundry, planning and preparing meals, or waking themselves up on time in the morning? That's a big one. They can also start thinking about doing things for themselves or for other people, like calling to make an appointment, keeping their own calendar, offering to walk a neighbor's dog. A lot of the families I've worked with, the teenagers want to learn how to call and order a pizza, which may be a dangerous skill, but a good one to learn. They can also learn how to take public transportation and volunteer or work part-time to learn about job skills. And one thing that's important to mention is that when I work with parents to start thinking about what they can do to help their child prepare for adulthood, they often end up having a pretty big realization that they do a lot for their child. They often realize that they're kind of stepping in and doing a lot to avoid problems. And so by doing that, they may be preventing their child from learning from experiences and reacting to things in the moment, because the parents have learned so well what works and what doesn't work for their child that they don't give them opportunities to sort of problem solve in the moment. So they find it helpful to try to step back in places where they normally jump in and to give their child opportunities to learn from those experiences. And this is hard, but it is okay for youth to make mistakes, and learning how to respond when things go wrong is important. And parents can help their child learn and practice what to do. So I often suggest that families start with allowing for small mistakes, or ones that they're comfortable seeing their child fail at. But often they come back and tell me that they were surprised that the child didn't actually have as much trouble as they expected. And so these can be really important learning opportunities for the parent as well, for the parent and child to both learn, to learn from experience and to try new things. So that's usually positive. The third tip is to help figure out what works. Youth with autism can face many challenges, including depression, social anxiety, executive functioning problems, sensory sensitivities, varying levels of motivation, and stress. And if you're working with youth with other diagnoses, they may have similar or different challenges to think about and to sort of consider when wondering what works for the child. And so it's important to develop ideas to work around their challenges to promote success for the child. So here on the screen, there are questions that parents can start to think about. For example, are there certain tools or strategies that help their child feel more comfortable? What activities is the child motivated to do? Sometimes parents say nothing, but there are always things that the child is motivated to do. So thinking about what those are and kind of building around that. What helps the child calm down when they're stressed? in what settings and with what people is their child most successful, and how does their child learn best? So thinking about these kinds of questions and learning what works for their child can give both parents and youth new insight to help them plan ways to adapt and develop strategies to be successful when they are entering new places or just thinking about adulthood in general. And eventually we want youth to learn how to adapt and develop their own strategies when they face challenges, but during childhood and adolescence, parents can play a really important role in this process in helping figure out what works and then teaching their child to develop their own strategies once they know what works. The fourth tip is to communicate. We recommend frequent discussions about the future, which can help both youth and parents prepare for adulthood. During conversations, parents should remember to be open-minded, which we talked about in the first tip, accept and appreciate their child, which I'll talk more about in a moment, and set goals together. To set goals, I suggest making small practical goals together regularly. I've listed some examples on the slide, but goals could include cooking a meal, learning how to use the washing machine, or searching for summer jobs. And we find that these goals are most successful when the youth initiates the idea, so when it's something that they want to learn how to do. But sometimes they need some guidance. So if a child is having trouble coming up with a goal, we often ask parents to suggest several ideas and have the child select one that they want to work on so that they do have buy-in in what they're doing, even if they couldn't come up with an idea themselves. And it's also helpful to identify goals that are immediately relevant to the child and family. For example, there was one family that I worked with, and they were in the process of moving, and so the parent realized, oh, this would be a great opportunity to teach my child what all the processes are for changing your address. So they went to the post office and completed a change of address form, and they went online to change their address for their credit cards, and just learning about all the various things that need to be changed and updated when that sort of life change happens, which can be a really important skill for the child later in life. They may not remember, but they know that there was a lot involved and that they went through it, and maybe their parent can help again when that comes up, but it's something they have some exposure to and experience with. And one final thing I want to mention is the importance of respecting the child's identity, and I think this really ties to some of the things Lauren talked about earlier. For youth with autism, this can mean teaching them about neurodiversity, which is a social movement built around the notion that people with neurodevelopmental conditions, including autism, have unique strengths to offer their communities, and that they should be accepted and welcomed as valuable members of society. And positive family support and really acknowledging this idea of neurodiversity can go a long way in promoting a child's well-being and potential for success in adulthood, increasing their confidence and kind of ability to be successful as an adult. So I'll just close by showing some links to related resources which are available through this webinar. And these are transition-related resources and other things related to what I talked about, as well as some suggestions for search term items so you can find local kind of programs in your area. Here's my contact information. Feel free to let me know if you have any questions. And now I'll pass the time to Joey Hanna from my local Utah Parent Center.
Good afternoon, everyone. Thank you very much. I'm excited to talk to you today about my organization, the Utah Parent Center, and parent centers in general. Can I get the next slide? I'm sorry, I can't switch it from my side. Okay, so I wanted to give a brief introduction to what parent centers are. The funding grant that funds parent centers across the country are called Parent Training and Information Centers. Parent centers are funded out of the Office of Special Education Programs of the U.S. Department of Education under IDEA, or the Individuals with Disabilities Education Act. To give a little bit of context, the IDEA is a federal education law originally passed in 1975, and it requires that schools give special education services to kids with disabilities who need them. The law covers kids from birth through high school. In IDEA, there is a requirement that all states have a parent training and an information center, and all parent training and information centers are peer-to-peer support and are governed and operated by parents. Two of my co-presenters sort of mentioned in their presentations about the importance of peer-to-peer and parent-to-parent support when working with when families have kids with disabilities, and as a family, as a person who has a child with a disability, I personally can attest to the importance of having a good peer-to-peer support network to learn from. Okay, next slide. All right, so as I mentioned before, the IDEA requires that every state have a parent center. So every state, territory, and the District of Columbia have at least one federally recognized parent training and information center. There are nearly 100 PTIs across the nation. Some of the larger states with a larger per capita have more than one parent training and information center. In Utah, we only have one. California, I believe, has 3. New York has several. So across the country, parent centers serve almost 1 million parents and individuals with disabilities every year, including in some of the other work that parent training centers do is provide statewide systems level advocacy work and help decision-making lawmakers at the state level to ensure that laws and affecting our children are taken into consideration. Next slide, please. So what do parent centers do? Some of the work of parent centers, and I want to say that all parent training and information centers provide direct services for children and youth with disabilities and families and professionals and other organizations who support people with disabilities. But every parent center has a little bit of its own essence. For example, the Utah Parent Center, we have really kind of marketed ourselves to sort of specialize in transition and assisting with youth to transition to adulthood. The Pacer Center out of California, which is a parent center, they are the National Bullying Prevention Center. And so all parent centers have a little bit of their own essence and a twist. And so, but some of the things that all parent centers do for sure are workshops and training. They provide information and referral. They provide individualized help in person or via the phone for families. Almost all centers have a newsletter. They provide individual assistance with IEPs, 504s, and IFSPs, which is a super important service if you're working with families that have kids with disabilities that are in school. Oftentimes, this is an area that families really need some additional support, and that information and that support can be invaluable. Parent centers also provide information and individualized support for youth transitioning to adulthood. All services at the parent center that are offered under the Parent Training and Information Center grant are free for families. Some parent centers do offer fee-for-service for other services, but all services offered under the PTI, again, are free. Okay, next slide. Another program of note, several parent centers across the country, and a little over half of the organizations that hold the Parent Training and Information Center grant also hold a family-to-family health information center project, which is called the Family to Family Network. They provide direct support and intervention to families who have kids with special health care needs. They offer direct support such as early intervention, behavior supports, crisis intervention, caregiver support, other support groups, and also self-advocacy-led trainings. In Utah, our Family to Family Network project provides a lot of assistance to some of our local constituents on assisting them with getting signed up for Medicaid programs, for Social Security disability. So all family-to-family health information centers in all states would be able to offer that same resource to families and that same support. So all states also have a family-to-family project that's funded out of HRSA, and some parent centers hold that project, but not all. Okay, next slide. So a little bit more information about the family-to-family health information centers that I mentioned before. Again, they have a lot of similarities to the parent training and information centers. However, these centers really focus more on assisting families and people who have children with complex medical and developmental needs. Again, they provide one-on-one assistance to help families navigate the complex systems of Social Security, Medicaid, and the medical system. They help families ensure that they have a medical and dental home and also access to mental health services. They also are a peer-to-peer network and support. All of the people who work on these projects have lived experience. They also do a lot of advocacy at state and federal level to help lawmakers and stakeholders understand the needs for families with kids with complex medical needs. Next slide, please. I wanted to be able to provide the 2 links where you could find at your particular parent training and information center and then family-to-family network in your state. So if you go to the Parent Center Hub or to familyvoices.org and just search for your state, you'll be able to find the center in your state. And if you are a human service worker or a social worker who works with families with disabilities, these are 2 of your go-to resources that I, as a family member and as director of a parent center, would say should be right in the top of your Rolodex if you are working with families with kids with disabilities, because most of them are sort of one-stop hubs for resources for your families. And if they don't directly offer the resource, they certainly will have the most accurate information available locally in your state as well as nationally to best assist with the families that you're working with. And so I'd like to turn my time now over to Jackie, who's going to lead us through a question and answer session.
Thank you so much, Joey. And just a reminder before we get into the Q&A session, you can ask a question by using the Q&A pod at the bottom right-hand corner of your screen. So if you enter in any of your questions there, we will be compiling those and using them in the moderated session. And now I'm going to turn it over to Robin, who will be facilitating the Q&A.
Thanks, Jackie, and thank you all for such great information. We do have a good number of questions that have come in. It's interesting, some of the questions that came in early, I believe we actually were answering as they were coming in through some of the subsequent presentations. So I'm going to kind of sort through these. So the first question that we have is there any research on how parenting a child with special needs impacts parent-to-parent spousal relationships? Any tips or strategies related to healthy relationships for this specific group of parents? So I'll just start by saying in the Resource Center, as I mentioned, we have a whole section on strengthen your relationship, and there are lots of tools on communication and conflict management, which any time there is a situation within a family that may be uncomfortable or stressful, the most important thing that couples can do is to actually communicate and share and have that openness to be able to talk about what's going on. But I want to also toss that question to Joey in the context of the parent centers. Do you guys offer resources that focus on that aspect?
Yes, thank you. Absolutely. That's a fantastic question. We do. The Utah Parent Center, we have a whole curriculum that we offer for caregiver support. And, you know, our state, we have some specific resources that we refer families to who might need more intensive counseling. But I would absolutely assume that the majority of parent centers across the country would also have some specific resources in their local community, as well as some links to some national resources. But that is definitely an area that is extremely difficult to navigate for caregivers, for sure. So yes, I would certainly contact the parent center as well as the family-to-family network organizations in your specific states.
Perfect. Thank you. This next question I'm going to offer to Lauren and then Ann. Where can I find information on signs my child may have a developmental disability?
You know, that's a really good question. Sometimes parents don't really have much of a sense of that at all, and it's a clinician, you know, in the newborn nursery or maybe at a well-child checkup who will break the news, and parents say they're completely surprised and caught off guard. They weren't expecting it. The other thing that can happen is that parents have an inkling. They see some concerning behaviors. They see their child not making developmental milestones like other children that age, and parents are the first to notice those early signs and take them to a clinician. So where to go if you think you're seeing a concerning behavior or delay? I would say go right away to your family health care provider, the pediatrician, the family nurse practitioner, whoever that might be. Sometimes if you don't have such a person, you can also talk to the daycare provider. I don't know, you can talk to people in the community and get a referral to a workup. And you can probably supplement that.
Yeah, I just want to mention that families can themselves request an assessment for early intervention, which is through IDEA Part C, and every state and territory is currently participating in Part C. So every state does have an opportunity for families to request an assessment, and as part of Part C of IDEA, they should be able to get an evaluation, and that would be to see if there are any developmental delays or other needs. That's only for children who are birth to 3, though. Older than 3, there are different processes, and that might be through the school or, as Lauren said, through the pediatrician or other healthcare provider.
Great, thanks. So the next question is, are there professionals that specialize in grief counseling or another field that can help parents and or siblings navigate the initial and periodic grief that may arise related to differences in traditional life benchmarks? The first thing that I would say to this is that if we're talking about at the time of birth or at that newborn kind of time frame, postpartum depression is a real thing, and so many of your employee assistance programs or other health providers offer postpartum depression type counseling and so forth. But I would ask of our speakers today who might answer this one, maybe Lauren, maybe Ann, or even the Parent Center, tell us, are there those that specialize in this? I thought it was an interesting choice of word, the grief counseling.
You know, that really is a really good choice of what parents experience. It can be very intense, and it can last a little while. I don't know of any specialized resources in that regard, and I wish I did, frankly. I think, as you said, Robin, maybe starting with an employee assistance program, starting with, again, a healthcare provider who could provide a mental health referral. I think getting in the mental health system is a start, and maybe more specialized referral could get you someplace that's a little more attuned to the particular needs of parents in this situation. Anybody else have more to add there? Ann?
I don't. I might refer people to the Parent Center, but Joey can say whether that would be useful or not.
Yeah, sure. I mean, I certainly can talk on the topic from my own perspective, and I would say, the things that have helped me in particular, and that we see regularly here at the Parent Center in Utah, is, I'm not sure that I would use the word grief, but for myself, but I do think that is most certainly a feeling that people feel. But I think peer-to-peer support, I think support groups, I think, as was mentioned before, some individualized counseling and some specific, care for a parent who might be having a difficult time. But we do see a lot of good outcomes. We offer a few different caregiver support opportunities here, including support groups. We have a health and wellness support group that we're just starting, that we're doing some mindfulness and meditation classes, and the data that we get is really good. And so I think a peer-to-peer sort of support group, and then also, again, just probably some individualized mental health counseling is what we would definitely recommend.
Could I tag on to that? Would you mind?
Sure. No,
this is Laura, and I was just going to say that you got me thinking about this, Joey. Parents also say that they find peer-to-peer resources online. They find moderated or closed Facebook groups. They find other online ways to connect to people. So even if they live in a rural or remote area, they can sometimes find connections to other parents that suit their needs.
excellent point. Thanks. So I'm seeing a couple of questions I'm going to kind of consolidate here that are focused on the same concern. The idea of navigating when you have children in the family who have been determined to have developmental disabilities, and you have other children in the family who do not. Are there resources that are specific in working with the child who does not to help them better understand these developmental disabilities? Now, I'm guessing that things like the parent advocacy and the focus groups and the peer-to-peer groups are a good place for that, but are there other opportunities to kind of learn on how to deal with that situation?
This is Joey again. I hate to be plugging all the parent centers, but it was a priority in our last RFP that parent centers across the state do offer sibling workshops, or we call them SIB shops here in Utah, and they are literally sibling support groups. We also have found that it actually really helps siblings to have the opportunity to advocate for their sibling, and so we recently have started to do a youth a youth advisory group here out of the Utah Parent Center that is comprised of individual youth with disabilities and also their siblings, and they're doing some state level advocacy and policy work that should be, we're hoping will be really interesting. But the majority of parent centers and family-to-family network organizations have some type of sibling either support group or other ways that siblings can get involved, and also most certainly resources for parents on how they can best work on some tips and things that they can utilize in their house to best ensure the health and safety and mental health safety and proper development of the kid who has a sibling with a disability.
Great, thanks. And Joey, while we've got you in the hot seat here answering questions, tell us, from your perspective, what is the best way for human service agencies and programs to partner with parent sitters?
That's a great question, and I for myself here for our organization here in the state of Utah, we have an excellent partnership with our Department of Health and Human Services. We specifically have a grant and a partnership with the state of Utah to operate a family-to-family network that is a way to reach families all over the state who are participating in our disability service program or the Medicaid waiver program here for adults with disabilities. And so there's a lot of different ways that states or that human service individuals can partner with parent centers. I think if you're working with a specific population and you have training needs or opportunities related to disabilities, I certainly would reach out to the parent centers for that. If you are working with with families that need just to be linked with resources, I think if you have some type of resource fair, certainly invite your parent centers to that. I think really there is really kind of no end to ways that human services can partner with the parent centers. I hope that sheds a little bit of light.
Yeah, so just a follow-up to that, how do we make sure, because a lot of people probably didn't know about parent centers until today's webinar. How do we educate those folks in the community who might need to partner on your type of agency and the need to partner? Is there some way that you guys promote parent centers across the country?
I think it really is individualized. It really kind of depends on on the nonprofit that operates the parent centers across the country. There are some requirements for us as parent centers, and there are some requirements in terms of the boards of education in each state. Every board of education in every state does have a requirement under IDEA that they partner formally with the parent centers and allow the parent centers to offer formalized training and education in all of the schools. And so I think parent centers are pretty well known in schools. I don't know that they are as well known in human service agencies across the state. And so I think, again, it's hard to say exactly how centers promote themselves across the states. And I will say that I do think that this may be the case with a lot of disability services, and it is a little bit unfortunate, but a lot of parent centers, a lot of other disability services are certainly not in a position where they are hurting for business. We certainly we always have a capacity issue out of our center here, and we are pretty well staffed. And so parent centers in general, my guess would be, don't put a whole lot of effort into really advertising themselves much, which is a little bit unfortunate. And but parent centers are obligated to serve their whole state, and again, in some states there are more than one, so some outreach might be better in some states than it is in others, for sure.
Yeah, that's probably very true. And I'm guessing, especially for the early years before they get to the education system, there's probably a lack of knowledge. So it's probably very important for parents to be advocates for their children and reach out on their own, or talk to their healthcare providers and make sure that they're even aware of these resources so they can make appropriate referrals. So a couple more questions. I have a question here about how to find the parent center in a particular state, and I believe that there was a link that you offered to find that information, correct?
Yes, ma'am. It's on this slide.
Perfect. So that information is there. And then I have another question. How do neurological assessments help children with autism, and what exactly is it? Ann?
So that's a question for me. So how do neurological assessments help children with autism? Is that right?
Correct.
So families may find a neurological assessment to be helpful, and some groups I know include MRIs or other more like brain-based assessments in their diagnostic process, but there is not a need for any sort of neurological assessment to receive a diagnosis of autism. It is a behavior-based diagnosis, so the child is assessed based on their behavior, and some of that through having a conversation with their parent to talk about their behavior that that they see in everyday life, and some of that is through a clinician observing their behavior through various tasks. So that's how you receive a diagnosis of autism, but I do hear that other types of neurological assessments may be included. One of the main ones that I know of is to determine if the child has any seizure activity, because seizures are common in autism, and so that may be part of the diagnostic process, or just assessing if the child might be at risk for seizures. But yeah, other parents do. They show me like pictures of brain scans, and they may find it helpful for understanding what's going on with their child, but that's not part of the diagnostic process. Does that answer the question?
Yeah, so let me follow up. There's a more extensive question that has come in that actually ties to what you were just mentioning in terms of seizures, and so I'm going to share this one. I'm trying to condense it a little bit so it's not quite so long. So a situation with a child who newly diagnosed kindergartner, and the child is suffering severe seizure and has missed some school, and so now the school's got Child Protective Services involved, and the child has been evaluated, and seems to have a plan in place, but the question is, where do we go from here? The school, this individual feels that the school overstepped boundaries because they were reasoning was potty training issues, sleep disorder issues, and so forth. And so I think the point of this is that they're feeling like Child Protective Services was contacted versus the perception that this might have need a medical intervention. And so any recommendations on how we can educate schools that handle these situations?
That's really interesting. I think a shame that and I think a lot of times a lot of blame goes to parents, and so it sounds like the school assumed the parents were doing something wrong or being negligent when the child had serious medical concerns. So I guess my first recommendation would be to try to educate the school. If you feel comfortable sharing any sort of documentation that might be helpful in helping them understand. There are usually special education specialists at the school or in the district, and so they can be good people to reach out to hopefully advocate, because it may be school employees who don't know anything about students with disabilities who, took those first actions. And so that would be sort of the first steps I would take. It may be that something, more like going higher up the chain may be necessary, or seeking out some sort of legal action. But I think first step, I assume that the school just really didn't know what was going on, and so education seems like the best way. And unfortunately, sometimes that does fall to the parents, but I know, again, we're focusing on the Parent Center, but the Parent Center, I believe, does offer to help mediate communication with schools if necessary, or connect to other resources. But again, Joey, speak to that more.
Yeah, to me, if there already is an IEP team in place, and so the child has an IEP, and there's an IEP team in place, and it sounds like a real breakdown in terms of that team understanding all of the complex needs of this child and all of the complex needs of the family, and in particular the child's the child's needs in terms of the child's medical needs. And so I would 100% have the family call the Parent Center in your state and ensure that they have an advocate working on their behalf. They will completely understand the laws involved with IDEA and what rights and responsibilities the parents and the schools have. There is something, just off the top of my head in this particular case, this person would be possibly entitled to home hospital, which is to be able to have school in the home, have someone come from the school and provide education in the home if necessary, if the medical needs are to that extent. And so I most definitely would call the Parent Center. I'd make sure the family has an advocate from the Parent Center that can help them. They will attend IEP meetings with them if necessary, and they can be a real critical member of that IEP team. But again, it sounds like a real breakdown at the team level for that particular family.
Thank you for mentioning that, because there was a follow-up comment that there had been an IEP meeting and the parents were present and specialists were present, but I think the key in your recent statement was an advocate from a Parent Center being there. Honestly, regardless of what abilities or disabilities a child has, parents have to be an advocate for their child. And it's difficult to be an advocate when, as a parent, you don't understand everything yourself. And the schools can be complicated, and you have all of these people telling you all of these things, and you're trying to process what they're telling you and make decisions, and it's like they want you to make decisions on a dime, and it is very difficult and complicated. And I think anytime there's an advocate, I highly recommend reaching out to an advocate, someone whose role in this is to help you understand and guide you through the process. I think that's wonderful, and I think it's wonderful that the Parent Centers offer that service to families, because that particular scenario sounded to me like a clear breakdown, a lack of understanding. And we see that with children in schools often, even when it comes to things like diminished executive function, and these children are being mislabeled as having a learning disability when that's not necessarily what's going on, and they could be mainstreamed with some extra assistance. And it's one of the reasons why the Resource Center has taken this opportunity to try to provide some additional information in easily digestible nuggets, and you guys have done such a great job with these tip sheets that we really hope folks will take advantage of them and share them, and those who are in the service industry will share them with the families that they work with so that we can help get some of this information out and make sure that families have access to the information, again, in a way that they can digest, because sometimes these specialists are so complex in the way they try to talk to you. It's overwhelming already, and then you're getting all of this information in a complex format. So I totally agree on the advocate aspect of it. I think we've covered all of the questions so far. Are there any more, Jackie, that I haven't seen?
I think mostly covered. I just sent you one more, Robin. I'm not sure if you've gotten it yet.
Let's see what we got here. So there is another question about a neuropsychological assessment differ from a functional behavioral analysis. Speaking of complex terms, does anybody want to tackle that?
I think I may be able to. So my understanding is the neuropsychological assessment may look more like a diagnostic assessment that could include, again, like, does the child have autism, and what else is sort of, what is the diagnosis, what's going on more kind of medically. A functional behavior assessment, my understanding, is something that a behavior therapist would do. So that might be an education psychologist or another psychologist who might have a board-certified behavior analyst certification, and they are trying to understand like the antecedents and consequences, so like what comes before and after a child's behavior. Often this is centered around behaviors that they might want to change. So if a child is, for example, engaging in like self-harm, they may try to figure out what might be frustrating the child beforehand, or what someone might be saying beforehand that might lead to that, and then try to change those aspects of the environment. This is not something that I do specifically. It shares some similarities with what occupational therapists might do to understand what's going on with a child and make adaptations. But so I don't want to overreach my expertise, but that's my understanding of a functional behavior assessment.
That's my understanding as well. And then given that, for example, autism is considered, a complex disorder, and so biological, environmental, and behavioral. And so you've got the neuropsychological aspects that are looking at certain pieces of that, and then the behavioral that are looking at, what's actually going on in terms of the child's behavior or young adult's behavior, and how do we figure out what to do with all that. So I hope that we've answered all the questions. Does anybody else want to add something to that?
I could just add really quick. So for me, my son has had both a neuropsychosocial evaluation as well as a functional behavior assessment. And so the neuropsychosocial was something that we were able to utilize in terms of getting his diagnosis. And again, it was mentioned earlier that you don't need a full neuropsychosocial to get an autism diagnosis, that you can, there are several other screening tools and diagnostic tools that can specifically diagnose autism. But the neuropsych for us gave us a lot more insight into the way that our son learns. It really helped inform his IEP in the sense that we were able to come up with some really specific tools based on that assessment for him, as far as the way his own specific brain processes information and learns. And then the functional behavior assessment is a process that really identifies specific target behaviors for the purpose of behavior and what factors maintain the behavior that is intervening or interfering with a student's educational process. And so, and usually the functional behavior assessment is what is utilized is the assessment that's used to develop a behavior support plan for kids in schools and adults that might be receiving some other type of behavior therapy. So it's really more specific to behavior. I mean, that's my experience as a parent. I am not a clinician.
Well, parental experience sometimes is the best experience, right? Because it's firsthand.
Sometimes. Yeah.
Sometimes. And I think that that's the case. Unfortunately, no one gets instructions with their child, right? So a lot of times parenting is a learning experience. So I want to give each of you a chance for any final thought before we wrap up today's webinar. I so appreciate the information. It has just been very exciting to me to hear all of this great stuff is going on out there. So I'm just going to call you out and give us any last comments that you have. Lauren, we'll start with you.
Sure. For me, this has been a good experience because I think we've heard from parents that there are a lot of what I would call small, detailed, day-to-day, in-the-weeds kinds of challenges. And I'm not diminishing those by any stretch. Those are exactly the decisions we've been talking about, how to get assessments, how to find the appropriate care and resources, how to find support from other parents and professionals. And I think my thought is that is important and deserves lots of attention. And my message today was, let's wrap that up in a larger narrative about what does that all mean. You know, at the end of the day, who are we as parents, what's valuable and important, and how are we going to do our best, and how are we going to make a hopeful and meaningful sense of all of that. So I applaud parents. I, too, have a child with special needs, and I think all of us are in this together, and we're really doing the best we can every day. And I appreciated the postcard messages that provided that kind of wisdom. So thank you, everyone.
Thank you. Anne, last words?
Sure. Thanks again for having me. It is interesting to circle back to some. I worked a long time ago in more early intervention with young children, and my more recent work has been with adolescents. And so, a lot of what we've found is that all the work that providers like me had done with young children, parents had gotten so good at working with their children and supporting them, and then and so that's, I think, a testament to how hard families are really working. And then in adolescence, it's important to, I think, reframe and start to step back some. I realized that I often tell parents, I'm like, oh, I told you several years ago you should do this, and now I'm telling you to kind of pull back. And so I just want to emphasize that what I talked about is really, things to be thinking about when children are older and when a lot of the sort of nuanced struggles are sort of figured out and you're starting to think about adulthood. So I think it's, not everyone is there yet, and so it can be overwhelming to think about adulthood when children are young. So just want to emphasize that what we're doing in childhood is great, and then adulthood, we just have to sort of think about things a little differently. And I hope the tip sheet can be helpful in helping people think about that.
Thank you. I'm sure it will be. And things are different, but, I think it's a really wonderful conversation to be able to talk about on the front end when you've got a new situation. And I feel like your tip sheet gives hope on the later years. So it really kind of reinforces some of the things that Lauren says. So I'm excited about it myself. So, Joey, we've gotten a lot of questions about the Parent Center. So I put that slide back up so people can see how to find a Parent Center in their state. And I'll give you an opportunity for any closing comments.
Absolutely. And please, if anybody has any, specific questions, I'm absolutely happy to answer any general, information. If you want to also put my email back up, I'm certainly happy to answer those questions. And I guess my final thoughts are just really that there are a lot of amazing people doing work around disabilities. Every state has a university who is doing research. Every state has a parent center. Every state has a family network. And so I think my biggest takeaway is just if you're working with families, just make sure that you have some really good resources at your fingertips and get families connected with family-to-family, peer-to-peer networks as soon as possible, so that they can have an advocate. Because, you know, I am the executive director here at the Parent Center, and I still bring my own employee, who is the advocate in my son's school district, to me to IEP meetings, because I think you had mentioned, Jackie, or maybe, I'm not sure who it was who had mentioned, but it is very difficult when you are in the center sometimes, and when you're working, when it's your own child, you have a difficult time accessing all of the information. It can get really emotional when you're dealing with some of the stuff that kind of comes across our plate. And so, yeah, that would be my takeaway. Just make sure you have a good list of good resources, including parent centers, including the centers for people with disabilities in your states, and all the other resources that are available nationwide. Tap into those, become familiar with them, and, you know, make sure that you get them in the hands of the family.
Awesome. Thank you. And thank you all again. I am, our contact information, the Resource Center contact information is here on this slide. If we can be of assistance to anyone, or if somebody didn't get the information they needed to off the webinar today and has a question, they can certainly contact us, and we can reach out to any of the presenters and get that information for you. But again, thank you all for joining us. Thank you again to our presenters for such informative discussion, and I am going to turn it back over now to the team for the wrap-up, and don't forget the survey that's going to follow.
Yes, thank you so much, Robin, and thank you to the three speakers for your expertise and willingness to share today, and thank you so much to the audience for your thoughtful and engaging questions. As the webinar concludes, there will be a brief survey that pops up on your screen. Please remember to provide your feedback using the survey, and it will help us plan for future webinars. Once you complete the survey, you'll be able to access your certificate of completion for attending the webinar, and we will also send out the survey via a follow-up email after this if you miss it. If you have any additional questions, like Robin said, you can contact us at info@healthymarriageandfamilies.org. And we encourage you to check out more of our resources and information on our website at www.healthymarriageandfamilies.org. Thank you so much for joining us today. Bye, everyone.